that applies to all of us, especially the junior doctors in training. I'll give you the real life example, which is me, and you can ask me any questions. So this is the talk about bullying, which is obviously the trainee's worst nightmare. When you start training, you have big plans, finishing training, finding a consultant job. No one really prepares you about the challenges that happen outside the educational setting, rather than exams and things. So when I started training, I had no idea what bullying was. I didn't realize it was happening. So I think it's important to have that awareness so that you're able to pick it up before things go very wrong. So I'll talk about a little bit about bullying, focusing on trainees and how to seek help and who to go to and what to expect out of all this process. So unfortunately, the problems with bullying are there in NHS. It could be related to just one person. It could happen at organizational level. And along with bullying, what happens is the fear to speak up, basically. So it's not just one problem. The other problem just follows along. There's no legal definition of bullying, but the easiest definition I could find is by ACAS, and ACAS defines it as any behavior that's intimidating, the abuse or misuse of power, and any behavior that is intended to undermine someone, to humiliate someone, and this behavior is always unwanted and unwelcomed. Employers have a duty of care for their employees, for their mental health being, and it's their duty to protect them from bullying as well. Undermining. So undermining is any behavior that shatters your confidence, and if it gets escalated, it eventually turns into bullying. So it's very important to look for those little things happening rather than things escalating to bullying. Now, harassment actually has a legal definition. It's been defined in the Equality Act of 2010, and it's unlawful, and again, it's unwanted as well. So it's any unwanted act that's related to gender, sex, race, or any religion belief, and has the purpose of violating anyone's dignity. And again, it's also unwanted, and it can also be defined as any act that is considered by that person that's affecting their well-being, that they think is hostile, that they think is intimidating. Little examples here: if you've been criticized in front of patients or other staff members, if you've been asked to do jobs that you're not trained to do, if nobody's appreciating your contribution, or if they have unrealistic expectations from you to complete certain responsibilities, any sort of shouting or swearing at someone, devaluing someone's input, or excluding people on purpose, if you've not been provided enough supervision, or if there's absent supervision, and then belittling by senior members of your team. Everything counts as bullying. Now, what's the prevalence among the trainees? So this is an old NET survey from 2023, and as you can see, a lot of people know about it. So 70% people said they knew about it. 90% are saying they know how to raise concerns. But when it's actually time to raise concerns, the percentage goes down to 1%, which is eye-opening. Why would people not do something which they feel they are aware to do? A lot of people who were discriminated against, they were not really reporting it. So I think there is a fear of reporting things, and there's a fear of things getting worse than they actually are, which prevents trainees to speak up, and a lot of people don't know how to seek help and where to go. So what are the causes? In my opinion, it mostly happens in high-pressure environments where there are long hours and stressful situations. A lot of it is to do about the power dynamics, the hierarchical system in the NHS. We all have ES and CS to support us, but there's actually inadequate support from the support providers. And there's lack of mentorship and guidance as well. If you Google, you can get more info about exams and things, but nobody really prepares you when you're going into training. What impact does all this cause on trainees? So obviously, if you're going through something you've not been prepared for and something that's not really expected, it takes all your confidence away. You're demotivated, you're burnt out, you sometimes feel like taking time off training, sometimes you feel like you just should give up. Obviously, it affects your career because if you're not able to carry on, then that goes down the bin. It creates a toxic workplace environment where nobody's respecting each other, nobody's getting along with each other, everybody's fearful of things going wrong, so everybody's silent, nobody's really talking to each other. And then it compromises patient safety and care. If you're in an environment where you're being bullied, you're not going to raise any concern. Forget about yourself. You're not going to raise any concern about the patient either because you're so fearful. And then there is an organizational cost as well because trainees then leave their training program or they go out of training program on long-term sick leave. So all in all, it's not just one person that's getting affected. It's the entire department, and again, the entire organization gets affected. So I'm the real life example here, and that's why I'm standing here and talking about it. So when things started happening, the examples I've just given you, I didn't realize what was happening. I've never worked in a department like that, so everything was so new to me. So the first important thing I would say is you need to have an awareness in order to realize that it's happening to you, because if there's no realization, you're not going to take the second step at all. Then once I realized it, I had no idea who to ask help for, and I was too afraid to ask for help. Again, it was the fear of things getting worse because people are more powerful, they're my consultants and they're my supervisors. So there was fear of judgment as well, as I said, and things getting worse. And then once I started developing the confidence, talking to different people, I realized that once you start standing up for yourself, once you speak to people, there are helpful people around and there are people who support you. If you've worked with someone and they've seen you working, they're obviously really helpful. I would say it's always best in these scenarios to try an informal resolution. So you can speak to your educational supervisor, clinical supervisor, try and get it sorted within the department without escalating it. But obviously, if everything else fails within the department, then you have certain other ways to go forward to. You can involve your occupational health. If you're a member of BMA, you can involve BMA. There's certain other organizations who help me. You can go to your head of school if you have a head of school, because in pathology we have one, and they're really very helpful and very approachable as well. Obviously, nobody's just going to listen to you and make a decision. There will be investigations happening, so you have to be prepared that this is going to be a really difficult time in your life. More difficult than what actually happened. You just have to stand by yourself, and people will come and support you. This is what I have really learned. Those investigations are not easy, but the results that come out of it obviously favor you if you are the person that's saying the right thing. So in my scenario, I was just offered the dean retransfer, which was the best thing that happened to me. I'm almost at the end of my training. I've done all my exams. So I think what I really learned from all this, that if a flower is not blooming in certain environment, it's not the flower that's the problem, it's the environment that's the problem. So don't be afraid of getting out of a training program, moving over and starting all over again. It's all doable, and you just need a very good environment to do all this. And then I learned resilience, which is hard way to learn, but I'm there now. This is my favorite book. I think everybody should read it. And it has very good quotes about friendship, compassion, and courage. In all what was happening, it was the worst time of my life, and it could be the worst time of anyone's life, but it's very brave and magnificent of someone to just carry on, to just not give up. So always remember that. talking about ethical and legal considerations. So all NHS trusts have the zero tolerance policy that applies to bullying coming from patients or discrimination coming from patients, and it works the other side as well. And there are clear reporting mechanisms in place for you to report all these things. And just don't give up. Guidance for trainees. So in my opinion, the first thing which I realized I was lacking is the awareness. If you don't have the awareness of equality and diversity, you will not recognize certain behaviors that classify as bullying. So I think that's the first important thing. You need to really educate yourself before going forwards. And don't be afraid and don't be shy of speaking up. Find someone in the department who you've worked with, gotten along really well, who's seen you working, and just go to that person, and that person is going to help you forwards. As one thing I remember from all these meetings, my head of school said, your supervisors have to be your mother, sister, father, and brother in that department. And that kind of just stuck with me, because at home, if something goes wrong, who do you go to? To your mom or your dad, right? So always remember that. As I said, try and resolve things informally. Speak to your clinical supervisor, speak to your educational supervisor. If they're not very helpful, there's always a training program director you can go to. But while you're doing all this, one thing that I didn't do is you have to keep a diary of all these events. You don't have to sit down and write all these things down. When you're emailing, asking someone to help you, that's the diary of events that's happening already. Any written communication you're happening, that should be in your email. Anything verbal happening, you should be able to write it down just to have an idea what you've been through and what have you asked for. Now, who to contact in workplace? Starting from your CS, if they're not helpful, go on to your educational supervisor. If they are not helpful, go to your training program director. If they're not helpful, your HR is really good in advising you who to contact and what sorts of mechanisms are there. And there's an employee assistance program, which a lot of us are not aware about. Occupational health is very important. Nobody needs to refer you to occupational health. You can self-refer yourself to occupational health, and they take it from there. If you're a member of Royal Colleges, we have Royal College tutors, and they're very accessible and they're very helpful. In my case, the best person from the hospital point of view was the head of school. And obviously, if you're a member of organizations such as BMA or any local organization, as I was, they've been really helpful, and they've been supervising, supporting, and then accompanying me in the meetings that I had. And that is all you really need. There's a freedom to speak up guardian. So when we start training, there's a small presentation, one slide about freedom to speak up guardian, which we don't really care about, but that's the most important slide if you're starting your training, and that's the most important email address you need to have. There are other professional support and well-being services which differ from trust to trust, but every trust have them. There are also trainee representatives, not only from BMA, but some hospitals have junior doctor representatives as well, and you can talk to them confidentially, and they can take your information further as well to help and support you. So if the matters are not resolved within the department, there are formal processes as well. If you're doing this pathway, if you're doing the formal grievance, you need to submit all the evidence within 3 months of it happening, and you need to be ready for any investigation that happens, any conversation that goes on, and obviously then they'll give you a result, but you have a right to stand up, and you have a right to appeal if you disagree with whatever the outcome that comes out of it. One thing to be very mindful of, everything you say, everything you write, formally or informally, is part of an evidence. So choose your words very wisely, because if an investigation starts, if a disciplinary process happens, if you've written something, it could be used or taken against you as well. Again, when all these things happen, sometimes you don't value yourself. You just lose your own value. So one important lesson in all this, because it's not something that's going to get sorted in a day or so or in a week or so. It's going to take months to get sorted. Don't give up on yourself. You're the most valuable person for yourself, even if the whole department or the whole hospital doesn't think like that. If you give up on yourself, I think that's the moment you've just lost it. So that's very important to just keep reminding yourself, because in all this process you're going to be by yourself most of the times. People will help, people will talk, people will reply to emails, have meetings, but it all will just end. So you have to be really patient and then just keep trusting yourself. This is again from my favorite book. As you can see, I've used it so many times. I've put this quote for a reason here. Where the boy is thinking if there was a school of unlearning, because I remember when I had meeting with my head of school, the first thing I was told that it was my mistake that I've raised it so late, and I've just gone through it so over such a long time. We are all from different backgrounds, different cultural backgrounds. We've not been raised in a way that we'll speak up if an adult is doing something wrong, or if someone is just belittling you. So that's one thing to just break off. Everybody's respect is important, and everybody's equal. It doesn't matter if someone is elder or if someone is younger. So you have to unlearn certain attitudes and certain behaviors if they have been embedded in you from such a young age. So that's another thing that we need to work on ourselves. And be kind. The only people I remember in last 8 months when I went through all this were the people who were really kind to me. And I would always be grateful and look forward to meeting them, and I'm always there to help them as well. So a lot to learn from it, how to deal with pressure, how to stay calm, how to be patient, and how not to just lose courage. Again, when you get deanery transfers or when you go to a different hospital, the time doesn't end here. There are expectations from you, and people will keep a strong eye on you, because everybody will have certain opinions from what they have heard or from what they've been told. You'll have to work really hard, the way you've always been working, and you have to just prove yourself. I have heard one line within 1 week saying, we've been keeping an eye on you, and within a week we realized that you were not the problem. And I think that summarizes everything. Things will happen to some extent, because no place is perfect, no place is 100%. You just have to understand when these things happen, and then you're more strong to voice yourself and nip those things in the bud. And as you progress in your training, you will also realize that you just have to pick your battles wisely. There's no point in picking up every little thing. You have an aim in front of you. You have your exams to pass as well. Stand up for yourself when you have to. And also, when you're becoming senior, you have to look out for your juniors as well. So in all 4 years of my training, I've been able to help other juniors as well when they were not able to raise their voice and their concerns. And I think that makes me really satisfied that I've actually learned something out of what I've been through.